Guys, it's James here from Australian Nutrition Centre, and today's topic is thyroid. So, a lot of people seek us out looking for a second opinion. They may have already been diagnosed with a thyroid condition and have medication prescribed, or they've been wondering if their thyroid is responsible for all of their symptoms. Perhaps they've been told by their doctor that, something's not quite right, but we'll just keep an eye on things that don't quite require treatment yet. But anyway, I want you to know that in our clinic we like to take a more proactive approach, because ultimately people come to us because something, still isn't right, and I guess they want help right now. Now, the first step with managing thyroid is to get your bloods done correctly. Now, we like to measure not just TSH, but also T4, T3, and antibodies. Now, that might seem like it's a little bit too thorough or overdone, and some of your doctors may not be keen on this, but the reason we do it is because it actually helps direct us in where we need to go. In some special circumstances, we even look at reverse T3. As part of doing that thorough blood workup, I also like to look at nutrients, like vitamin D, zinc, selenium, iron, and B12, because I know that deficiencies in these will lead to a poorer functioning thyroid. And sometimes it's not about working on the thyroid specifically, it's about working on the things that help it work, all the things around it. And as I said earlier, these bloods, that's what lets us know where to look next. Now, the common thing that we see is that somebody's thyroid might be functioning okay, but we always want it to get it to great. So sort of say with people, your bloods are great normal, they're normal, they're low normal, or sometimes they're just bloody horrible. And like I said, this sort of, when we do these bloods thoroughly, that's what directs, the next sort of course of action. If we see high levels of antibodies, then we know we must work on the immune system. That allows the thyroid to work better. As you can imagine, if your immune system is busy attacking your thyroid's not going to work so well. In helping reduce the antibodies, we do things like looking at some of the triggers. So it might include changes to diet, like gluten sensitivity is a common thing that's associated with poor functioning thyroid. Again, looking at anything with gut health or reducing inflammation. We look at exposure to toxins, things like fluoride in our water, even amalgams or fillings that haven't been taken care of properly. That can leach some toxins in and affect our thyroid. Epstein-Barr virus or glandular fever, that's another common exacerbator of the thyroid. Things like a parasite or even the common H. pylori infection, they all need to be considered and taken into account when trying to manage the thyroid. Now, as I said earlier, we test for those deficiencies, and we also look to correct any of those nutrient deficiencies, which sounds really obvious, but when we do that, great things can happen. I often use things like selenium and inositol because that's a great way to bring down thyroid antibodies, and that makes a huge difference to a lot of people. Like I said, if we stop the immune system from attacking the thyroid, we get much better thyroid activity. Sometimes it's as simple as correcting protein deficiency and iodine deficiency, which then just allows the body or the thyroid to just make more thyroid hormone. Zinc's another big one that we commonly see as a deficiency. Zinc will also, if it's deficient, throw some of our results out, so that's why we always like to test zinc when looking at thyroid. And more importantly, when we look at using some of these nutrients, that helps maximize the conversion of T4 to T3. And we look at the relationship and ratio between these two, because that gives us a clue, if you're under converting or over converting, and then what we need to do. For those who don't already know, thyroxine, which is the medication you usually get prescribed for thyroid replacement, is just T4, but we're then relying on the body to convert it across to T3 efficiently. If it doesn't do that, that's one of the reasons why you'll see a lot of the symptoms that still remain. So again, correcting those deficiencies and reducing inflammation can enhance the conversion of T4 to T3, and that in itself will get rid of a lot of thyroid symptoms. All in all, I guess what I want you to really know is that there can be something done about thyroid. You don't have to just accept, feeling lousy or feeling like it's not being properly managed. At the end of the day, if you take the time to look at it, invest the effort into that, then that's when the great things can happen. And lo and behold, after seeing patient and patient after patient, who have these issues, and then we correct them, and then seeing the wonderful results that they get at the end of the day, that's really satisfying for me. But it does tell me that so many of you out there are struggling with this, and this is why it's something that we're pretty passionate about, making available to people. But also, it's also inspired one of the things that we'll have coming up. So we're going to look at going to do like a thyroid reset program. That way, those people who would normally not be able to afford our services will have greater access at a cheaper rate. But also, it means that we can look to do it in a group setting where others can support each other, especially when we're doing things like dietary changes. So that's something that I wanted to give you guys a heads up about. But please, if you got any questions, shoot them through. If you'd like any more information, please just ask. We're here to help, and we're desperately passionate about getting people to feel like they should. Thank you.